Could a damaged heart valve lead to cardiac arrest or stroke? Discover how valve replacement surgery can save lives and bring the rhythm back to your heart. Valve replacement surgery is a procedure to replace a damaged heart valve with an artificial or biological one.
So the heart is a pump. Its function is to pump blood around the body. It has got two main parts, the right side and the left side. The right side of the heart serves the lungs, sends the impure blood to the lungs, and the lungs purify that blood that comes to the left side of the heart, and the left side of the heart then supplies the blood to the whole body. Like any other pump, the heart cannot function without functioning valves. Basically, the valves must permit blood flow without any obstruction strictly in one direction, and when needed, they must open and close. Open so that there is no obstruction to blood flow, and close so that the blood doesn't leak back. It keeps going in one direction. So there are two ways these valves can be affected. Either they become narrow and offer obstruction to blood flow, or they fail to close, which means they leak. In either way, we have to fix them if they are symptomatic and medicines don't work.
Warning signs of valve disease include shortness of breath, chest pain, fatigue, swollen feet, or an irregular heartbeat. Remember, early diagnosis is key. Doctors may replace the aortic, mitral, tricuspid, or pulmonary valve using either a mechanical valve or a tissue one. The choice depends on age, condition, and lifestyle. Complete journey of valve replacement surgery includes preoperative test, hospital stay, procedure, recovery, and follow-up care. The total hospital stay is approximately 3 to 4 weeks for international patients and 7 to 10 days for domestic patients. Recovery after the surgery typically takes about 6 to 8 weeks. Recovery means more than healing. Follow your cardiac rehab plan, eat well, avoid strain, monitor vitals, and never skip checkups. Now, let's talk about the cost of valve replacement surgery. In India, surgery costs range from 2.5 to 4 lakh for domestic patients and 5,500 USD to 8,500 USD for international patients. Add 15 to 25,000 or 250 to 400 USD for preoperative test and 4 to 6,000 or 60 to 100 USD for medicines and follow-ups. Costs vary by valve type. For example, mitral valve 3.5 lakh or 6,000 USD. Tissue valves tend to be slightly higher due to material. Along with this, accommodation, food, and travel charges should be considered, still much lower than the global average. Costs are affected by valve type, hospital, patient health, and post-operative care needs like ICU or extended stay. Vaidam Health provides the largest network of top doctors and hospitals to patients worldwide. Vaidam simplifies your treatment journey with this wide range of services.
I have been in India through Vaidam team, and then I came here for my heart valve replacement. And then I just want to say thank you to Vaidam team to look after me during my treatment there. So I'm proud of what facility they have bring forward to facilitate our medical treatment here.
We at Vaidam serve patients in the top 9 destinations of the world, and we focus not only on one but a wide range of treatment specialities. Vaidam has successfully assisted over 100,000 plus patients. For any medical assistance or to start your treatment journey, contact Vaidam Health.